Hello. In 2011, there was a greater than 700,000 hospital-acquired infection. This is according to a report by the Center of Disease Control in 2016. Research by the Center of Disease Control in 2016 suggests that healthcare-associated infections are the most common complication of hospital care because prior practices of hygiene are not working and there needs to be a continuation of education. Today, I will discuss two main points of the transmission of germs and bacteria. I will inform you on ways that clinicians as well as you yourself can help in decreasing the spread of infections. Point number one. According to this chart by the Center of Disease Control, there was an estimate of greater than 700,000 total number of infections in the hospital in the United States in 2011. As indicated, out of 6 listed infections, 2 are tied at 157,500, and the lowest one is 71,900. According to CBS News in 2016, 65% of physicians and other medical professionals admitted that they had not washed their lab coat in greater than a week, and they were aware that it was visibly soiled. Bacteria can be transferred to clinicians' clothing by coming in contact with infected surfaces. For example, during a patient's assessment, the medical profession leans over the bed to look, listen, and feel. This gives the lab coat the opportunity to come into contact with soiled linen, wounds, and other sources of contamination. And then the same lab coat is worn into the next patient's room. Also, if that scrub comes into contact or becomes soiled by body fluids, such as by spills, the area of contamination should be decontaminated immediately and the clinician's scrub should be changed. WebMD in 2009 states that 80% of germs are spread by touch and suggests that a minimum of 20 seconds or more of proper hand hygiene can decrease the spread of bacteria and germs. If you aren't performing proper hand hygiene, you could be the one transferring infection to another. You would think that hospitals are properly sanitized at all times. Every object that a person touches has been touched before. CBS News in 2016 report that items such as telephones, faucets, keyboards, and remote controls are overlooked in the cleaning process because they do not look visibly soiled or dirty. We can all assist, including you, in preventing the spread of infection and bacteria to others by washing and sanitizing our hands before visiting a patient and after visiting a patient. Point number 2. If proper procedure was followed for sanitation, patients would be much safer. Proper procedure starts with education. According to Stone in 2016, education programs help with infection control. But due to a shortage of educators, inconsistent policies, and the lack of adherence, there is a lack of effectiveness. Adherence is important. CBS News states in 2016 that the housekeeping department can follow protocol when cleaning if surfaces and objects that would reduce 2/3 of the spread of infection are cleaned properly. The Center of Disease Control in 2016 states that when clinicians make a conscious effort to adhere to their training and work together, lives can be saved and patients can be protected. They also state that hospitals have an ongoing educational program for medical professionals. And in conclusion, research by the Center of Disease Control in 2016 showed that healthcare-associated infections are the most common complication of hospital care because of improper clinician hand hygiene and the absence of cleaning of the environment. Hospitals may appear to be squeaky clean, but they are just the opposite. Continuing education, following policy and procedure can greatly decrease the risk of infection by the spread of bacteria and germs. Our main focus should be on doing our part in infection prevention. Following protocol and policy will be effective for the patient and the clinician. Today, we have discussed, first, prior practices for prevention of hospital-acquired infection does not appear to be working well. We have also discussed ways to prevent the transmission of bacteria and germs, and that education following policy and procedure can greatly decrease that 1 in every 25 patients that have a hospital-acquired infection.